Hello and welcome back to the Second Chance to Live channel here on YouTube. I'm happy to see that you decided to stop by to watch this video presentation. In this video presentation, I'm going to be sharing an article that I recently wrote and published on Second Chance to Live. To read the article, I'll put my glass back on and bring up the article. I want to thank you for your time. You're an important part of my process, and I always enjoy our times together. Here's the article. Rotator cuff tears, physical therapy strategies. You may not need surgery. Background. Hello and welcome back to Second Chance to Live. I'm happy to have you around my table. On May 24, 2007, I wrote this article, Continuing to Train in Martial Arts with Rotator Cuff Tears. Don't give up on your goals. And I have a link to that article here in this article. Through my process, I discovered that no surgery was required to repair the rotator cuff tears of my infraspinatus, my supraspinatus, and my subscapularis. Below is an account of my process, and I would encourage you to read this article and or listen to this complete video presentation as I share important information that has helped me through my physical rehabilitation process and strengthening my shoulder to buttress or strengthen my rotator cuff tears. Examination of my left shoulder by my primary care physician. In lieu of the pain in my left shoulder, I set up and attended an appointment with my primary care physician, who is also a sports medicine doctor. Upon being examined, he told me that I would have to have surgery to repair the rotator cuff tears, which he assumed I had. He ordered x-rays and an MRI. I had the x-rays done that day and waited to have my MRI scheduled. The news and what having surgery would entail and the needed rehabilitation process post-surgery put me in fear. This is important information about MRI machines that I discovered. Different types of MRI machines. Regular MRI, wide-bore MRI, and open MRIs. After the MRI was scheduled, I went to have the MRI done. However, the regular MRI was too confining. At this appointment, to have the MRI, I found out that there was an alternative to the MRI tube that I felt constricted in, a wide bore MRI. After the wide bore MRI was scheduled, I still found that the wide bore MRI was too confining. I then found out that there was another alternative, an open MRI. I was scheduled to have the open MRI and was instructed to have my primary care physician prescribe a medication to help me relax during the MRI, which I got and helped me relax. Suggestion if you are claustrophobic. If you have any difficulty having MRIs due to claustrophobia, or being claustrophobic, I would recommend an open MRI. There are openings to your right and to your left when you're in the machine at your head. So if you look peripherally, you can see the opening on the right and on the left. So, excuse me. If you also I would also suggest that you have your primary care physician prescribe a medication that will help you relax during the time in the MRI tube. My shoulder MRI took between 25 and 30 minutes, and I did not feel claustrophobic in the open MRI. Results of the open MRI on my left shoulder. After having the MRI, I got the report that showed I had tears in my infraspinatus, my supraspinatus, and my subscapularis tendons in my rotator cuff, as I understand. The report reinforced my fears, but I'm glad that I did not give up on the possibility that I would not have to have surgery. I decided to visit a physical therapist that I had seen in 2009 for meniscus tears in my right knee. During the appointment, the physical therapist had me move my arm in various range of motions and tested my shoulder strength. No surgery on my left shoulder required. After seeing my range of motion and testing my shoulder strength, he told me that I would not have to have surgery. Hearing the news greatly encouraged me. I was so happy and relieved to know that I would not have to undergo surgery to repair the rotator cuff tears. The physical therapist gave me some exercises to begin at home. I set up another appointment, and over the past 3 weeks, my shoulder has strengthened and I am on the mend. Suggestion and hope: you may not need surgery to repair your rotator cuff tears. In the event that you have been told that you need to have surgery to repair rotator cuff tears and you have had an MRI, I have a suggestion. Consult with a physical therapist and ask them to test your range of motion and the strength of your affected shoulder. If you have good range of motion and strength in your shoulder, you may not need surgery. Please check this out before you undergo any surgery to repair your rotator cuff tears. Working with a physical therapist will help to reduce inflammation, strengthen your shoulder, and reduce discomfort. Past experience with doctors and orthopedic surgeons who told me that I needed to have surgery. My primary care physician after the initial examination said that I had to have surgery, otherwise I would lose function in some of the muscles in my left arm. What he declared put fear in me and was simply not true. My experience has been with doctors and orthopedic surgeons is that they seem to want to push me into surgery. I'm so glad that I consulted with the physical therapist that I consulted with and saw for a period of time in 2009. This is my experience at the time that I just referred to in 2009. Medical, I had medial meniscus and anterior hood of the lateral meniscus tears of my right knee. In 2009, during my training for my black belt, my right knee locked up. I saw my primary care physician at the time, a different primary care physician, who scheduled an MRI on my right knee. I underwent the MRI and the results showed medial meniscus and anterior hood of the lateral meniscus, both on my right knee, had torn. I subsequently consulted with 2 orthopedic surgeons who both said that I needed surgery. I met someone at the YMCA who had similar meniscus tears. He told me that a doctor had told him that if he had surgery to repair the meniscus tears in his knee, that his knee would become unstable. My primary care at the time set me up to see a physical therapist. The physical therapist told me that I could strengthen my knee to support the meniscus tears and in the process avoid surgery. So I worked 4 to 5 times a week for 8 to 9 months to strengthen my right knee. I worked to strengthen my right knee by walking the pool forwards and backwards, riding the stationary bike at a low resistance, and engaging in some weightlifting to strengthen my knee. With time, my knee got stronger and I was able to start back training in full Muay Thai knees and full and Muay Thai kicks using my right leg and knee. I'm so glad that I consulted and saw a physical therapist at the time, although several orthopedic surgeons wanted me to have surgery to repair my meniscus tears. No surgery needed to repair the meniscus tears. In March 2009, I wrote an article, When Circumstances Change Our Plans and Dreams, to share my experience surrounding these meniscus tears at the time. You may read the article to gain more insight by clicking on this link. And here in this article here on Second Chance to Live, I provide a link to When Circumstances Change Our Plans and Dreams. Disclosing the impact of my traumatic brain injury to my physical therapist. Strategies used to compensate for my traumatic brain injury while working with my physical therapist. Over the course of the past 3 weeks, I have attended appointments with the physical therapist. He gave me instructions during the appointments. Sometimes I would write these instructions on a piece of paper, and other times I just listened. What I found was that when I did not write things down, I forgot what he told me and needed to clarify what he had said at the next appointment. With growing awareness, I disclosed to my physical therapist that I experienced a traumatic brain injury in a motor vehicle accident when I was 10 years old. I told the physical therapist that I needed to write things down, what he was telling me during my appointments. Otherwise, I would forget them. I also asked him to, I also asked him if I could have his email address to be able to ask him for clarity, ask questions, and share concerns between appointments. He said yes, and I have asked for clarity, sent questions and concerns to him via his email address. He has been gracious and kind to me to give clarity and answers to my concerns and questions. Thank you for your time and kindness, Rick. If you are living with the impact of a traumatic brain injury and working with a physical therapist, I would encourage you to disclose to your physical therapist that you are living with the impact of a traumatic brain injury. This may help both you and them. Helping them understand that you need extra help may help them to be more patient with you. Traumatic brain injury is an invisible disability. Without your physical therapist having insight into what you need as an individual living with the impact of a brain injury, both you and your physical therapist may experience frustration. Such frustration may lead to stress and interfere with your physical therapy process. Stress that will interfere with your ability to benefit from your physical therapy. Suggestion. My suggestion is that you write things down as your physical therapist tells you my suggestion is that you write things down that your physical therapist is telling you to do between appointments. By writing things down, you'll have reminders and notes that you can refer to after your physical therapy appointments. Also ask your physical therapist if you can have their email address to ask questions and share concerns as they arrive between appointments. My ongoing process in physical therapy. I am fortunate to have a physical therapist who allows me to email him for further clarity as I have questions. I am glad for his time and kindness toward me. His clarity gives me peace of mind. Thank you, Rick. I'm doing exercises, I'm doing the exercises that he has given to me. I've been able to start back training with short collie sticks to enhance both sides of my brain and my body using the principle of neuroplasticity. Thank you to everyone who has prayed for me. My shoulder is on the mend. God is healing my shoulder. This is the end of the video presentation. Before I go, let me encourage you with this. Please do not give up on yourself, a loving God, or your process. More will be revealed to you and to me with time. The pieces of the puzzle will come together in the correct order and at the right time. I'll say so long for now. Have a great day, and God bless both you and your family. So long now.